Good afternoon, everybody. My name is Connor here with McKay-Dee Hospital. I am joined with Dr. Akhtar as well as Dr. Adams here at the McKay-Dee Vascular and Vein Clinic on the North Campus in the medical building. That used to be the old outpatient building. So if you guys are trying to figure out where we're at, we're across from Weber State. It's near where like Sports Med is and all of that. So. But today we are here to kind of talk about this clinic, what you guys offer, kind of go through the procedures. We've been kind of talking about it. It's really cool. I'm really excited for you guys to see. They've got some demonstrations, and we're going to kind of do a little tour through the clinic here in just a second. So let's first jump into how this clinic came about.
Okay. So we have been part of a group that's been in existence for about 25 years, and we've been offering vascular services to the community both here and in Salt Lake for that time. And over the last 6 months, Intermountain has decided to partner with us to improve their vascular surgery services both here and in Murray. And as part of that, Intermountain has decided to build us a brand new clinic, and we're really grateful for them and for the facilities that they've provided for us.
Yeah. I'm excited. So for those of you who are also watching, we have an open house coming up on April 12th, and it is from 4 to 6 p.m. here, so you'll actually be able to tour it and kind of get to know you guys and understand things a little bit further and kind of see what we're talking about, so I'm excited for that. So I wanted to jump in and talk about the vascular part. So we're going to meet up with you here in a moment. We're going to follow Dr. Akhtar through kind of the vascular side of things, and then we'll meet up to talk about the vein.
Okay.
Got that right?
Yep.
Okay.
We'll see you guys in a minute, okay?
Sweet. So let's jump in over here. And we're headed to where exactly? The first room right here?
Yeah, so this is our first room here is our vascular room where we do our testing for our patients. Then you have vascular studies, and what that really means is we do ultrasounds of the various arteries in the body, including the arteries in the neck called the carotid arteries, looking for disease in the carotid arteries as well as the lower extremity arteries, upper extremities. We look for DVTs in the legs.
What's DVT?
So DVT basically is a blood clot in the leg veins. It could be in the arms as well as it could be in the legs as well. But we have a full lab here that can do all these vascular studies. And looking at everything in terms of the neck, aneurysms, lower extremities, upper extremities. We do all of that kind of testing here. So
okay. So I was told, let's step in because I kind of want to show. There's lots of equipment. Let's maybe go through what each of these machines does or doesn't do, because this looks techie to me.
Yeah. So this is a ABI machine, or ankle brachial index machine. It measures basically the blood flow down into the ankles and see how much blood flow you're getting there. So this is a treadmill to sort of have them exercise. We measure it before what the blood flow is like, and we measure the blood flow after the exercise to see if there's a drop in the blood flow, which tells us that there's probably a narrowing or a blockage in the artery somewhere along the leg, and that helps us sort of hone in on our where we need to look.
So this is cool because it's just right in the clinic, right?
That's right.
Dr. Adams was kind of mentioning that it's important that this is here.
Right.
And that's just because of why?
Well, this is here mainly because we see patients and we can do the studies here rather than having them send them out to the other places to have the studies done. It's more convenient for the patients. They can have it all in one. When they come and visit us, they get the ultrasound stuff, and they can have all the studies done at the same time rather than having two separate visits. So that's very important to us. And if there's somebody that comes in, it's an emergency situation, and we need to look at it a little right away, they're here, they're available, we can do it right away. So
yeah. And I think the other thing I like about it being here, for me at least from a patient perspective, is it's the same caregivers that are taking care of you from initial kind of studying your thing to maybe like your experience once you kind of get over
That's
it
right.
and actually have your procedure.
That's right. And the benefit for you is that we read all these studies. We look at them personally ourselves. We're looking at the ultrasounds, the live images, and making decisions about your care based on that. And then after surgery, we continue to follow you up with the same studies to sort of track our progress in terms of how you did after the surgery. So it all sort of ties in from the beginning to the end, you get all the full services here. So.
Right, which is cool. So this room isn't necessarily where you start, right? Or is it?
This is where you initially start.
Okay.
So when a patient has, if you have an appointment, you come in, you'll get the study done ahead of time. Then you'll see one of us, Dr. Adams or Dr. I, in one of the exam rooms. We're going to go to that in a minute, and that's where we discuss what we find on these studies and planning of surgery if needed, or what those results show. So I think
let's
it's
head
very
to that
important.
room
So
right
we can
now
go over there and take a look at that.
You've got some cool
Sure.
things to show us there.
So these are all exam rooms here. This is where we see our patients. We have full computerized system in the room there, so we can look at all their studies as well as show it to them as well. And it's equipped with all the stuff that we need to sort of make decisions about their care. So
Very cool. And so I love the sliding, like, almost farm door.
That's
but
right. So
it's hospital meets farm.
that's right. So it's kind of, so you come in, you get changed in here, and then I come in here and see you, and then we close the doors up.
Yeah.
It's fully private. We chat about what's happening, and then we go from there.
So let's go through. Let's take a seat here and explain. So I've done what happened over in the room we were just in. Now, kind of, what would you be explaining to me as a patient?
So based on the studies, we talk about specific diseases. Like this is this model looks at an aneurysm, and this is down in the abdomen or the belly where the aneurysm occurs. There's other aneurysms that occur in the chest, and this is mainly in the aorta, which is the main sort of the blood vessel that supplies the blood to all your extremities and everywhere else.
And this is probably a silly question, but an aneurysm is?
So an aneurysm basically is a dilation of this blood vessel. So it's kind of a sort of a tire that has a weakness in it and sort of bulges out. And that's what happens, is a weakness in the wall of this artery that allows it to bulge out. And if it grows and gets bigger, the risk is it could leak or rupture. And if it does that, that's a catastrophic event. And
Right.
our goal is to catch these things ahead of time and to fix them prior to that happening. And this is one of the reasons. This is one of the models that we use here. Is the minimally invasive way to fix this thing is to go through the groin arteries and put this stent graft. It's called. It's basically a metal framework with a fabric on the lining of it that basically seals this aneurysm right below the kidney arteries and then down into the arteries going into the legs. And that prevents the blood from going into the aneurysm, but also allows the blood to go down the leg and through these rings. So
Okay.
it's a good way to fix it. Less invasive. The surgery is much quicker. The recovery is much better, and people do very well.
And I think the
with this.
coolest thing that I've learned about this over time is that eventually your body creates like tissue over this device.
That's right.
And it kind of just becomes a part of you.
It becomes part of you. Whatever is left over of that aneurysm or the sac that was left over will start to shrink around the graft and sort of remodel that aorta
Okay.
back to sort of where it would kind of look like before
Right.
it got dilated up and got
Very
big.
cool.
So this also happens in the chest, and we do the same thing, less invasive way. We have an aneurysm there, and you just basically seal it off from above and below by putting the stent graft in, going through the groin arteries. This is all done under X-ray, and it's a very sleek way to fix it without having to have a major surgery of opening the chest or opening the belly to fix it. We could do it that way too because we're sort of more certified to do that, but this is much better tolerated by most patients.
And it's
that's
so
good.
tiny. I know you're holding like this big thing, but like think about this inside a vein.
Yeah.
How little and precise you have to
That's
really
right.
like get in there. So
Yeah.
I think that's cool.
Yep. This is the wave is sort of the future. This has been around for years now, and we know that this works and lasts, and it works very well for a lot of patients. The benefit is less complications, and then you go home much sooner. So it's a win-win overall.
Yeah. Anything else that we needed to know kind of about this side of everything that you guys do?
Yeah, I mean, the main thing is you get the studies, you see us, we discuss everything with you here, and then we plan on our surgery part where we do the surgery and then the recovery. The benefit for you is that when we do all these things, we follow you, we continue to keep track of everything that we've done. So that if there's any issues and stuff like that pop up, that we catch them ahead of time and fix them before things get worse. So
Yeah.
we do pretty much everything here in terms of vascular-wise. So it's not just focused on carotid disease, aneurysmal disease in the chest, in the belly. We also look at upper extremities. We look at patients with that have dialysis access issues that need to be on dialysis, we create all those access for them.
Oh, okay.
So patients that have, that need to be on long-term dialysis, there are not enough kidneys available for dialysis. So
Right.
one of the ways to dialyze them is to put in fistulas in the arms so
Oh.
that they can be hooked up to a machine and get filtered their blood out, usually 3 days a week, so that they can maintain a normal sort of a function.
Right.
Because otherwise, without having that, your kidney's not working, you don't survive.
Right.
And so we do all of that work. We do a lot of the vein work here in the office, and Dr. Adams is going to go over all that in a little bit with you guys as well, and he'll go over, look at the room and stuff. But we do everything in terms of the lower extremities as well. We do bypasses, we do ballooning of the arteries to open the arteries up. We do stents in the arteries to open the arteries up. So we do all the minimally invasive, but we can also, the benefit for us is that we can do open procedures as well too if we needed to. So we know what to decide what's best for you in terms of whether you need to have an open operation or whether you need to have a less minimally invasive operation.
So what would be something like, let's say, in my leg that you would be looking at? What would be causes of that?
So I mean, most people, when they complain of leg symptoms, they'll complain of pain mainly in the calf when they walk a certain distance.
Okay.
And that pain could be, it could be a short distance or it could be a long distance, and usually due to blockage in the arteries in the legs, and it could be anywhere in the thighs and in the calf arteries. That's not that's more of an inconvenience, lifestyle limiting problem, and we can help with that. But the patients that really benefit are the ones that have pain that's not bearable. They have it at night, every night. They can't sleep because of the pain in the foot.
Okay.
Or they have wounds on their legs that aren't healing in a normal time span, which is usually anywhere 2 to 4 weeks. They should be able to heal a normal wound.
Okay.
If they don't heal it, it's because they're not getting enough blood flow.
Okay.
So if there's blockages in the arteries, we can fix that. The less invasive is, again, the ballooning or stenting or going in and doing what we call an atherectomy, which is basically taking little pieces of the plaque out of the artery through these catheters and stuff,
Right.
and making the hole a little bigger so that more blood flow gets down to the leg to heal the sores.
Makes sense.
So, and if the blockages are bad enough or severe enough, or they're too long of a segment, then we would recommend doing a bypass, which is to sort of go around the blockages by putting in a synthetic graft or using one of your own veins in your leg to sort of create a new pipe,
Right.
basically to sort of reroute the blood flow back down to the foot where it was blocked off before. So
Interesting.
we do all of that, and we plan all that ahead of time, and that all can happen relatively quickly here, and especially in patients who really have wounds or are having a lot of pain in their feet and stuff. So
Makes sense. Well, fascinating. So where am I going next, I guess?
So we're going to go around the corner here and meet up with Dr. Adams here. He's going to show you our vein center here and where we do our vein surgeries in the office here.
Okay.
And we'll go over that aspect with you guys. So
Okay. Let's walk over. So this is kind of just more office space
this is
for
more
everybody.
office space for us and for the techs here and stuff. So.
Perfect. Cool.
So back here is our vein center room here, and Dr. Adams, we're going to meet up with him here. There he is.
Perfect.
Oh.
Okay, so he kind of told us all about the vascular side.
Okay.
So let's jump into, thank you first off, Dr. Akhtar,
No problem.
for joining us, and we'll maybe see you in a second.
Okay.
But we kind of wanted to learn about the vein part of the clinic, so we're kind of in the operating room.
Yeah, this is our
Right.
procedure room. This is where we take care of veins here in our clinic. So in order to, let's just talk about what a vein center is and kind of what that means. First of all, Dr. Akhtar and I are the only two vascular surgeons north of Salt Lake. And what that means is that we've been specifically trained and rigorously tested to operate on blood vessels in the legs and in the abdomen.
Okay.
And the other thing is that we are one of 3 accredited vein centers here in the state of Utah.
Really? Okay.
Yeah.
That's,
And so what it means to be accredited is that there is a company that is a third-party company, and we are reviewed by them for our quality. They'll go over all of our ultrasound studies that you saw done in our ultrasound room.
Right.
They'll go over all of our documentation. They'll go over all of our procedures and our policies to make sure that they meet quality standards.
That's awesome.
And so when you come here, you can know that we have met very stringent
You've jumped
quality.
through good hoops.
Yes,
to
that
be
is
here.
correct.
It's not just a show.
Yes.
It's to actually qualify you to operate and do all the things that we're talking about. So
Exactly.
that's awesome.
So the next question is probably, why would you want to come see us for veins? What kind of symptoms would you be concerned about? Okay. Some people come in because they have these big ropes in their legs that are varicose veins, and some of those can be so significant that they cause bad swelling. They can cause lots of pain when you've been on your legs all day long, and they can't really stand that pain at the end of the night. It can also be so bad that swelling can cause wounds in your legs. That if you go to a wound care center, they'll wrap your legs and they'll heal those wounds, but then they'll come back because we haven't treated the problem. Right? And so it's really gratifying to me to have somebody come in that's been dealing with these wounds for years, and then we can do these procedures and they stop. They get out of that cycle.
Right.
Of having to have
They're
wounds.
treated, they're
Yes.
heated, they're healed, they're
Yes.
good to go. Yeah,
Yep.
That's cool.
And so the process is you come to us and we'll talk about things with you. We'll talk about venous disease and what the issues are and you specifically. And then typically we put you in compression stockings, which are really tight stockings that decrease the swelling in your legs. And people typically have to be in those for about 3 months, and then after that we go on to do these procedures. And lots of people ask what these procedures are.
Yeah.
And I know as I've talked with people, their parents have gone through what was classically called vein stripping, and that elicits lots of fear in people because it's an operation. Yeah. And that's not how we do it today. We do it in a minimally invasive way.
This is an outpatient.
This
clinic.
is an outpatient clinic, and most people, they wake up from the sedating medication saying, "Are we done?"
Which is cool.
Yeah. It's very.
It's not a '60s horror movie.
No, I promise
Not at all.
it is not. I've got a video here
Yeah, I wanna see this.
on my laptop that kind of goes over what we do. This is the closure fast system, which is a radio frequency system. When all that means is it's a fancy word for the end of the catheter vibrates really fast and creates lots of heat and actually burns the vein. And most people think, oh, it's going to be burning and it's going to hurt. That is not the case. Like I said, people don't feel that because we inject anesthetic around the vein so you don't feel it burning. So let's go through this animation here and see what we do. So this is the actual catheter that goes into your vein. We get into your vein using an ultrasound machine here. And these are the veins in your legs. And this is a illustration of what good valves in your veins look like. This is an illustration of when they're not working, you have reflux back down that then creates pressure. And so what we do is we get into the vein with a needle, and then we put a wire into the vein through that needle, and we put a sheath in. And the sheath is basically like a straw with a one-way valve. And that lets us put the catheter up, and you can see when we use an ultrasound and we follow that catheter all the way up to where it joins into the deep system. After that happens, we use a needle to inject anesthetic around the vein. You can see the catheter here in the vein, and then we fill that compartment full of anesthetic, local anesthetic like lidocaine. And then that creates a situation where you get numbing and you get shrinkage of the vein around the catheter. Now the catheter is about 2 centimeters away from the junction of the deep system, and it needs to be that far away so we don't get blood clots. Okay. After we have all the anesthetic in place, and the catheter is where it needs to be, we activate the catheter and it burns the vein. And we do that in 7-centimeter segments all the way down your vein.
Until it's just
Till it's burned.
burned.
Yep.
Just fascinating.
Yes. And again, lots of people cringe at that, but you do not feel this happening.
Right.
Okay?
Okay. So this is one of the procedures, right?
Yep.
So what are the other couple that you do
Okay.
as well?
So there's a few other things that we do. There is a similar method to this, and that's with a laser, but it's kind of the same process. And then the other thing we do is called microphlebectomy, and all that is, it's a big word for really small incisions. Micro. And phlebectomy is removal of veins. So so if you come in and you have these big ropes in your legs that you're concerned about or they're causing problems, we make little small incisions, the micro part, and then we have what essentially looks like a crochet hook, and we go into these really small incisions and we pull those veins and we get them out, and then we put bandages on them. We don't even put sutures in them because they're so small. Okay.
Yeah, that sounds scary to me, but to know that that's just a Band-Aid, I could maybe do it.
Yeah. So
and
it's
you're
actually
under anesthesia.
So it's
Ish.
Yeah, ish. So it is sedating medication. So we're not like putting a breathing tube in you, but it's kind of like if you've ever had a colonoscopy where you're kind of sleepy and you don't remember what's going on.
Okay.
Okay.
So pretty simple.
Yeah, pretty simple stuff.
Okay. So is there one that's preferred over the other? Like which one is most common?
So what we do is this burning technique that I just showed you, that basically treats the trunk of the tree. Okay. And then the microphlebectomy portion kind of trims the hedges.
Oh, okay.
So to speak.
So sometimes you're getting both.
Yeah. Sometimes
Or
you're getting
always
both.
doing both.
No, not all the
Okay.
time. So if you just have a great saphenous vein, which is the vein that we just treated, or in the video that we just treated, if you just have that and you don't have any of those varicose veins, then we just treat you with this radiofrequency ablation procedure, and that takes about 30 minutes tops. And then, but if you've got lots of branches of that vein, then it's a microphlebectomy, and we actually go in and we take them out with little small incisions.
And you mentioned there's one more that you've been kind of starting to do. Mm-hmm. Insurance hasn't necessarily gotten there, but there's one more.
Yeah.
Let's talk about that.
So that procedure is called venous seal, and what that is instead of using a laser or a radiofrequency catheter to burn the vein closed, we actually inject glue into the vein. And that shuts the vein down. It's basically like super glue in your vein.
That's what the video looked like. It literally, don't go to the store and buy super glue.
Please
do
don't.
it yourself.
Please
Let
don't.
these guys do it. But that's really what it looked like.
Yeah.
So.
And so what that is, with the other techniques, you have to have little small needle pokes all the way up your leg to get that anesthetic around the vein adequately.
Right.
Okay. But if we're just injecting this glue, then there's no heat involved.
Right.
And so I don't have to give you anesthetic all the way up your vein. And so it avoids multiple needle punctures. And so it's actually more comfortable for the patient. And it works just as well as these other techniques.
Is it quicker recovery time as well?
Yes, quicker recovery time. And the studies that have come out on it say that you don't even have to wear those compression stockings afterwards, which can save people the hassle of putting on those compression stockings.
Well, speaking of recovery, let's walk over to the final step of the clinic, which is the recovery room.
Okay.
And kind of see what that's like.
So when you get down here, we'll wheel you across the hall, and this is our recovery area. And here you'll finally get to drink, relax. We've got sodas.
Did you say
for you.
drink?
Drink sodas,
soda.
not alcohol.
And diet soda?
Diet soda.
Right.
Yes. And we have snacks for you.
Okay.
And
so how long am I here? I think that's the...
Yes. So you're typically here about a half an hour to 45 minutes.
That's it?
Yeah. We just watch you for to make sure you don't bleed from those small incisions that we make, and we make sure that your vitals are okay. Your vital signs, your blood pressure, and your heart rate. And as long as you're comfortable, we get you changed, and we kind of get you out of here. Now, as far as recovery goes, you stay in the dressing that we put you in for about 24 hours, and then you take them down, and then you can shower, and then we have you put on a compression stock.
Right.
And that compression makes sure that the burning that we did gets that vein together and creates scar tissue very well.
Oh, okay.
Okay.
That makes sense.
Recovery is typically pretty easy for patients. It's pretty painless.
Is it like a return to work next day type of procedure?
So typically what we have, I do my procedures on Friday, Dr. Akhtar does his on Thursday. People take off the weekend, and then they can go back on light duty the next week.
Okay.
So it's basically
Okay.
the weekend.
Do I get to drive home, or is it have someone here?
Yeah, if you have sedation, we can't let you drive home because it's kind of like you're drunk, right?
Yeah.
So we can't let you do that. But if you come with a family member, then they can drive you home. If you don't have sedation, then you can drive home yourself because it's really not horribly painful.
This kind of sounds like a bunch of pricks in your
Yeah.
leg.
Yep.
That's about it. So pretty simple. We'll have Dr. Akhtar join us again. So I know we kind of did a little tour on the video today. I appreciate both of you guys kind of walking through what it is you do. It's fascinating. This was like 101 for me. I learned about it. But for any of you who are watching and want to come to the open house is April 12th. From 4 to 6 p.m. you guys can meet these two as well as everyone else at the clinic, kind of get a little tour. It's beautiful. I love the barn door, but that's just me. I don't know why I'm going back to that. But you guys are awesome. Thank you for joining. Is there anything else?
Yeah, the other thing that I wanted to say is that we're going to be here along with our nurse practitioner and our PA, and we're going to be doing free vein screening. So if you have any question of whether or not you are possibly a candidate to have any of these vein procedures done, we'll be here to look at your legs and
That's awesome.
talk to you about the process.
That's sweet. Cool. Well, thank you for joining. And if any of you have questions, please feel free to comment them and we'll get you an answer. Have a great day.